Hello, my name is Anh Thu, and today I will be discussing the case study topic of the Dale Morse and the New York State measles outbreak. So some background information on measles is that it is a highly infectious disease that can cause flu-like symptoms, and oftentimes you can see a rash appear on those who are infected with the disease. And more information on the case study itself is that New York State experienced two measles outbreaks in school children in May of 1982 in two of their local counties. So this school population was already well vaccinated with a single dose of the measles vaccine. However, they still caught the infectious disease and spread it around, and there was an epidemic. And so a second dose became a statewide policy. Looking at the current situation, measles is a preventable disease and is now considered eliminated from the United States as a result of effective vaccination policies provided by the CDC. However, weaknesses include the possibility of getting measles in the United States still, even though it is declared, quote, eliminated. It is also highly contagious and can become very serious if left untreated. The CDC and physicians took the opportunity to make recommendations for two dosages of the measles, mumps, and rubella vaccine to reduce the risk of infection. The threat still holds for individuals or families that travel abroad and can come in contact with measles or even domestic exposure from unvaccinated travelers. Prioritizing core issues. The root of the New York State measles outbreak is the failure of CDC measles control policy with their only one dose requirement. The school students in New York were also only immunized once for measles, and so a single dose schedule proved ineffective, and students still became infected and passed it to their families and peers. So the priority is to change national measles control policy to a two-dosage schedule. Analyzing alternatives. So looking at the socio-ecologic model, I came up with two approaches. The first one includes an implementation of a new second dose schedule policy for measles vaccine. The government policies are very effective when targeting a large population and helps with large-scale epidemics, such as this one in New York. And for my second approach, it is to promote community-based organizations such as schools to advocate for a second wave of vaccination for students and adhere to strict regulation during outbreaks. So in this way, school districts can control the outbreak from expanding by limiting interactions between sick groups and populations at risk. As for recommendations, my first one includes enforcing case isolations of school students who were positive for measles and offer them treatment, meanwhile also putting the rest of the school people and those whose students who are infected come in contact with under quarantine in order to regulate the situation. My second recommendation is to mandate a second dose of the MMR vaccine to improve immunization against measles in the entire United States population. And for my third one is to encourage physicians to recommend a second dose of the vaccine, but more importantly, organize health clinics to educate communities on measles. So, for my action plan, I thought that the Department of Health can collaborate with the CDC and develop a policy that mandates children to follow a two-dosage schedule requirement in order to go to school, which can take up to 3 weeks or even more. And also, that policy needs to be passed and become effective in the entire United States, which could take up to 4 weeks or even more. Also, we can inform schools about the new policy requirement and also educate parents, children, and healthcare officials about the need for a second dosage. Lastly, my opinion on it. I personally was fortunate enough to get the two-dose schedule for measles growing up and never have been sick with it. It is wise, I think, that parents are actively checking up on their child's immunization dates and know when it is appropriate to vaccinate them and keep them healthy and also their community healthy.